Hello, my name is Timothy Ryan, nurse practitioner with cardiac surgery. Today I'm going to present a short video for you that shows you how to obtain a blood pressure on an LVAD patient. As background, patients who have an LVAD or left ventricular assist device in place do not have a pulse. Therefore, a blood pressure cannot be obtained using standard means. Since the LVAD runs continuously, the patient does not have a systolic and diastolic blood pressure. Therefore, the blood pressure we're obtaining is the mean pressure. The items that you'll need to obtain a blood pressure on an LVAD patient is a manual blood pressure cuff, a vascular Doppler with an 8 megahertz probe. This is the probe that is usually attached to these Dopplers, and then some ultrasonic conductive gel. As with any patient, you'll apply the blood pressure cuff to the patient's upper arm, making sure you're using the correct size cuff. Using the vascular Doppler probe, you will find the patient's brachial pulse. Patients' anatomies are slightly different from patient to patient. It may take a little bit of effort to find it, but you should be able to find it. Once you do find it, it might be helpful to mark that area if you're going to do recurrent readings. With the cuff in place, and the Doppler in place where you hear an audible pulse, go ahead and inflate the cuff up to approximately 120 to 130 millimeters of mercury. This should obliterate the pulse. You should not hear it anymore. If you do continue to hear it, go ahead and inflate the cuff a little higher. As with any blood pressure measurement, you're going to slowly turn the pressure valve to release air from the cuff. You'll listen for the sound to return. That first audible sound you hear will be the mean pressure, and that's what you'll record for us. Our goal for these patients is to have a mean pressure between 70 and 90. If the patient's pressure is elevated on presentation, please ask them to sit down and relax and repeat the reading. If a patient's blood pressure is elevated after having them rest, please contact the LVAD coordinators for instructions. The contact information is located at the end of this presentation. As you can see, she already has the blood pressure cuff on the patient. She's going to apply the conductive gel to the Doppler probe. She's going to turn the Doppler on. She's going to locate the brachial pulse. You hear the pulse. Just going to inflate the cuff, slowly releasing the air. You hear a first sound at 78, and that's what you'll record for us as their mean pressure. Go ahead and clean the probe off and clean the patient's arm. You now successfully obtained a mean pressure on an LVAD patient.